Hello, my name is Ashley Rodriguez, and my infectious disease project was based on a microbe called Aspergillus Fumigatus. So what is Aspergillus Fumigatus? Aspergillus Fumigatus, also known as the black mold, is a highly ubiquitous microbe, this meaning that you could find it nearly everywhere, whether it's outside, inside, on the floor, in the air, nearly everywhere. And it could withstand a wide range of environmental conditions. Mostly, this is due to the fact that it is thermotolerant, meaning that it could survive very, very high temperatures. So usually that marks its success in the human body because our body temperature is usually around 37 degrees Celsius, and it could survive in those conditions. This microbe is the most pathogenic of the Aspergillus species, and has become known as the invasive Aspergillus. So this microbe is an opportunistic pathogenic fungus, meaning that it tends to target people that are already in the hospital because of their weakened immune system. Most infections occur in immunocompromised patients rather than healthy individuals. A fumigatus tends to ponder about in the human respiratory tree, which further explains its advantage against asthma patients or people with transplants, people with a history of cancer or brutal treatments in the past. It tends to affect those people more because of their weakened immune system. Also, lesions or lung cavities are ideal for Conidia to persist because they are very, very small, and it's harder for people with a weak immune system to combat them because they are in very, very small places, which macrophages can't really reach that well. So Aspergillus Rumigatus is part of the fungus kingdom. It consists of 29.4 million base pairs and has airborne spores, otherwise known as conidia, which range in diameter from 2 to 3 micrometers. So they're very, very, very small. A fumigatus is thermotolerant, meaning that they could survive very, very high temperatures. And something really interesting is that high temperatures can repress a fungus from further reproduction, but its pathogenic abilities aren't reduced because once our body temperature cools down a little bit, it could go on to being very, very pathogenic and reproducing even more and germinating at a high speed. So that is not good for us. And it could survive in a wide range of environments due to it being thermotolerant, like I mentioned before. It could survive in high temperatures and in regular temperatures. It could even survive in cold temperatures, surprisingly. So that is a little scary. So transmission and pathogenicity. Like I mentioned before, Aspergillus fumigatus is highly ubiquitous, meaning it could be found on the floor, indoors, outside, in the air, nearly everywhere, like I mentioned before. Transmission begins when conidia is dispersed and taken in through respiration. Typically in healthy individuals, they go by unaffected because our macrophages and defenses just fight it off. They fight off the non-self portion and keep the self, as we learned. Immunocompromised people, however, go highly affected by the microbe. Virulence is usually due to polygenic traits, meaning that it has various traits that build up to its pathogenicity, which includes how small the conidia is, its fast germination, how it's asexually reproducing. So that plays a big part in its pathogenicity. the microbe's ability to survive various environments due to thermal tolerance also is a part of its pathogenicity, because that means it could survive inside the human body and it could stay there for long and it could reproduce and germinate, and it gets worse and worse and worse. So, clinical features and symptoms. Some may experience fever, cough, shortness of breath, fatigue, allergies, nosebleeds, swollen eyes. I think I also saw in another case that some patient coughed so much that they ended up coughing up blood, which is a little scary. So diagnosing this microbe, it may be confused with bacterial or viral pneumonia, pulmonary tuberculosis, or asthma, due to its very similar symptoms. So usually the step one is non-invasive modalities, which includes swabbing or taking up mucus of the patient. And then in step two includes blood testing to make sure that everything is fine, there are no irregularities. And step three usually includes culturing and staining what we had previously swabbed to make sure that the microbe, to ensure that the microbe is there, or if it's not there, maybe it's something else, just to confirm that it is Aspergillus Fumigatus. So treatments are typically azole drugs. There is no optimal treatment yet, but these are our current options for treating this microbe. Azole drugs are usually treatment for respiratory problems. They are taking over a long period of time, so it's a long-term therapy, and it is the only oral treatments available for this microbe as of right now. However, it has developed high resistance over the time as more and more people are using it, and because it's becoming more and more common because more people are having more transplants nowadays. Its resistance has increased, and there are no guidelines for treatment once we have established that you have resistance to azole drugs. And it tends to be really, really bad for azole resistant patients because their mortality rates are up to 90, up to 100%, which is really, really bad, and we really don't want that. So the prognosis, the outlook typically depends on the host's response. For a weak response, it is very lengthy treatment, and mortality rates are from 90 up to 100% mortality. So it's really, really bad, and the treatment may not be as effective. They could reject it, or it's just really bad once you have it. And for a strong response, it won't stay very long in your system because our macrophages would fight it off right away. Our immune system combats it, and mortality rates are typically low because the microbe doesn't really persist for a really long time. So, in conclusion, this microbe is one of the most ubiquitous, opportunistic molds and most invasive of the Aspergillus species, as I talked about before. I think that in future research, we should find better treatments so mortality rates could lower and people have a higher chance of surviving Aspergillus fumigatus. And I think it's very interesting that they are looking onto combating azole resistance. Here are my references, and thank you for staying and listening.